And tonight in your weekly health check, the deadly signs of the flu. Well, guess what? The flu vaccine, it is working better in the season, but the Center for Disease Control reports that it's about 60% effective. But children still have died from the flu this year. So parents, there's things you need to keep your eye on if your little one happens to catch it. It's the hallmark sign of the flu.
Healthy and feeling well one day, and the very next day, sick, fever, sweats, body aches, muscle aches, joint aches, feeling very tired.
Unfortunately, those symptoms last about a week. Dr. Justin Schwalbe of the South Bend Clinic.
Over-the-counters can help just for symptoms. They don't really help shorten the duration or make things any better, any quicker.
But perfectly healthy children can die from the flu. So how do you know if your child's flu is about to take a deadly turn?
The second that they start working really hard to breathe, that's when you want to start getting concerned.
Flaring nostrils or tense neck muscles could be a red flag that breathing is becoming a struggle.
If their face is looking concerned when they're trying to breathe, like, then that's another thing.
The next and most important warning sign might seem normal.
Someone has the flu, they get better, and they can get sick again.
A second run of the flu implies a secondary infection.
What started out as a virus affected the body one way, and now it leaves room for another sort of infection to take place.
And that opens the door to deadly infections.
Pneumonia, sinus infection, ear infection, all sorts of other bacterial infections.
So it's important to stay on guard and monitor your child's fever.
As a parent myself, when my kid has a fever, I get anxious too. It's not something that we always have to think of as a bad guy, because fever can maybe even help fight an infection.
With a high fever, though, the body loses a lot of water, so it's paramount to keep your child hydrated.
Brand names would be Pedialyte, sometimes Gatorade as well could be quite helpful.
But if your child has a persistent fever of around 102 degrees, time to give the doctor a call. Dr. Schwalbe also says, as a parent, trust your gut. If your child has the flu and just isn't acting like themselves or showing abnormal behavior, take that seriously and talk to your doctor.